I think the predominant feeling that I got from the people I spoke to might be slightly different to what other people felt. The nurses in particular had an underlying feeling of guilt because they could see what was happening at the QE and at Good Hope and Heartlands, and I'd probably lost count of the number of nurses, healthcare assistants, nurse associates that came to me asking if they could go and work at other hospitals. In the January, we were asked to help at the QE site, Heartlands, Good Hope and other centres. We didn't ask any of our staff to go, they all stepped forward and volunteered, which was exceptional and all about the BC spirit. So in all we sent about 200 people to different organisations. They went in work's time but completely voluntarily, hugely outside their comfort zone. Some of our paediatric staff looking after patients who are 70 and 80 years old, very different needs, very unfamiliar environments. Our ITU nurses and doctors going to work in ITU at QE. We can't do a lot of the things that they do, we just can't do them. So some of our staff are working as healthcare assistants, turning patients over, doing their sheets, and they were actually grateful to go and help. Our staff went home crying. It wasn't easy, believe me. What they saw is not what we're used to, and the stories they heard, they're heartbreaking. So the difference that our people made to their people was huge, but I think what shocked them the most was that they kept going back. And we said, we don't make our people come here. They say, I can do another 3 shifts next week, and that's how it works. Some people were going on the days off because they'd formed bonds with certain patients, so they'd go on a day off and say, oh, I'm just going to pop in. Equally, the people that stayed, so we then ran this hospital on a lot less staff than we ever would normally. We would never run on short numbers, but we made a conscious decision to do that so that we could help other organisations. So the staff that stayed here didn't have it easy either at that time either. In many circumstances they were working doubly hard because they were staffed down on the ground. No complaints, lots of offers to do a little bit more to work when it was your day off. So the people that worked here are the reason that the people who went elsewhere were able to do it. Everyone worked as one, so I know that some people, it's easy to thank people that you saw in visors and gowns and everything over at the QE, and yes, we thank them for going, but we can't forget the people that worked twice as hard, who stayed here to enable that person to go. So if anything shows the teamwork that is, we've always had it here, I've worked here a long time, but the absolute gelling of people to make that happen just was phenomenal at that time. I think it's been great for some of the innovation that we've done is great for our children. Certainly I know in some services to come to a clinic appointment you'd miss a whole day off school. Some of our children have clinic appointments every month. Yeah. That's quite a lot when you're a 15-year-old studying for exams. They're not missing school at all now because they'll have a virtual appointment at 4 o'clock. They've made it home from school. So that in itself, I think, has made a huge difference. I think it's just made the organisation, if it's possible, better than it was before. It's been hard, it's been heartbreaking. We've had terrible losses. Everybody has been touched by the pandemic. I truly believe it, whether you show it or you don't. Everyone has got a story. But I think it's made everybody much more connected and compassionate.